lethal injection, and I'm not going to talk about those now, what they are, well, that's not cool, right? Allowing someone to die is okay, it's cool, because they would have died anyway. Actively killing someone, well, I mean, that can't be right. So that's sort of the gut vibe. I want to be ghetto right to begin with, just to sort of set the general sort of feeling. We call this passive, technically, and we call this active. It's not a good or a bad thing now at this level, it's just an analysis. So in terms of euthanasia, we would call passive euthanasia the form of euthanasia that condones or legitimizes the physician and the medical community's ability to allow the patient to allowing them to die, letting them die. Whereas active euthanasia, actively participating in the death of the patient, is classified as direct killing. So direct killing and its attributes, letting die and its attributes. Okay, now we can go a little bit quicker. The assumption is that it's humane, right? Letting die is humane, and direct killing is inhumane. Okay, obviously it's humane. Why? Because they would have died anyway. Obviously it's inhumane. Why? Because it seems like there's a fine, and in fairness to the critics, it's a fine line between murder and killing. The point of this lecture now is not to make the distinction between murder and killing, which there is a huge distinction between murder and killing, but it seems like you're killing. Well, not seems like you're killing. It seems like you're murdering the patient, right? It seems like you're active, which is false, but it seems like you're actively participating in the willful, intentful death of the patient, and that just seems bad. The argument later, obviously, as I gave you in the beginning, is going to be that it's not that. That it's not only a good option, it's a better option. It's a more ethical option than allowing to die. That actively killing is a good thing, right? Given this caveat, right? Alright, so this is permissible, obviously. And this is impermissible. This is what's known as a natural death, right? And this is known as mercy killing. I have every intent. I wanted to do a medical ethics lecture series for years, but you know, it's the vibe. I just gotta get the vibe to do it. I never had the vibe. I got the vibe. I did it. I've wanted to do philosophy of death lecture series since I started my YouTube channel. I haven't had the opportunity yet, but I feel like in the next year or so, I'm going to do a formal philosophy of death lecture series, which would be awesome. I already have the books. I've already done the research. I basically already have the whole idea of how I'm going to take the discussion. We would spend a lot of time just talking about natural death. I don't have the time here to talk about natural death other than say natural death is like dying naturally. Okay? Super generalized. I mean, that's a gross generalization, but you get the idea. You would have died anyway. Mercy killing is the sort of man on the street way, woman on the street way of referencing the direct killing of typically a spouse, right? So that a spouse will kill another spouse, and maybe him or herself, but primarily kill the other spouse out of mercy. Okay. This is an act of withholding. Right? This is an act of withholding. And this is an act of participation, P-A-R-T-I. Right? Direct killing is an act of participation, whereas allowing to die is an act of withholding treatment. This is acceptable, and this is reprehensible. R-E-P-R-E-H-E-N-S-I-B-L. This is reprehensible. And then finally, what's most important in this whole discussion is that this is arguably moral and this is immoral. And I put immoral in scare quotes, right? Alright, so that's what we have at stake. And the idea makes sense, right? The idea is simply it is better, the assumption is that it is better for the medical practitioner to allow the patient to die because the all the medical practitioner is doing is withholding whatever therapies, treatments, sustaining means of any means of sustenance for the patient to continue living. And once that's removed, the patient dies naturally on their own accord. Whereas the active participation in killing a patient seems like a bad thing. The point, again, one last time, just to make sure that it's clear what's at stake here, is that we're going to challenge this assumption. We, in terms of me via Rachel's, is going to challenge this assumption that this is immoral and demonstrate that not only is it moral to actively, directly kill, but that it is better than allowing to die. Right? So it's two things. It's not just that it's moral, it's that it's moral and it's a better alternative than allowing to die. Granted, the example that are used in the text are antiquated. Right? This is from 1973-75. The laws have drastically changed since then. What was legal at the time is no longer legal, so this example is completely dated. It wouldn't hold today. It's not about it being a factor in today's medical environment. It's medical ethics as such. So yes, to begin with, I understand that the example is dated and that the example is no longer relevant to today's contemporary medical community. That's not the point. The point is to give you an example so that you have conceptual understanding of the defense of active killing. That's the point. Okay, all my disclaimers aside, now we finally begin the lecture. Okay, so suppose, and here's a block quote, suppose a patient, and I'm going to read a lot because it's just such a beautifully written text, right? This article is, every single word is important. He's very succinct in his word selection and every single word is critical. Suppose, so this is the argument to try and convince you that active killing is moral and better than allowing to die. Suppose a patient who is dying of incurable cancer of the throat is in terrible pain, which can no longer be satisfactorily alleviated. The pain's just there. He's certain to die within a few days. We know that. But he does not want to go on living. Since the pain is unbearable, he doesn't want to go on living since the pain is unbearable. We can stop here and think about the discussion that I had in the last section, section 1.1, and think about the first of the 4 principles of medical ethics. The first principle of medical ethics is the principle of autonomy. We as medical practitioners have the ethical responsibility to respect the autonomy of the individual, right? So it complicates the discussion a bit, right? Granted, I understand the discourse, I know how this goes. That autonomy to want to die doesn't follow. It doesn't follow that it creates a corresponding obligation for me to kill you, right? Yeah, you might want to die. Yeah, you might not want to live, but it is a whole nother ball game to talk about me now as, representative physician X having an obligation to kill you. It doesn't follow, and I know it doesn't follow. The point is, however, that theoretically speaking, this person has incurable throat cancer. It hurts like hell. The patient knows it's going to die. But he does not want to go on living since the pain is unbearable. Suppose the doctor agrees to withhold treatment. So there's some treatment that's being given to the patient. You recognize that the patient has days to die. It's not a question. You cannot change the hypothetical example. You have to stay within the confines of the example. People do that. It annoys me to no end when students, you're teaching something and you give them a well-formalized hypothetical example and they say, well, what if? No, that's not the point. There is no what ifs. This is the example, right? And I'm not trying to be an ass about it, but that's the whole point of a hypothetical example, is to stay within the confines of the example. Okay. So suppose the doctor agrees to withhold treatment. The justification for his doing so is that the patient is in terrible agony. Okay? And since he's going to die anyway, it would be wrong to prolong his suffering needlessly. Right? So the idea is the patient, that's a direct quote, the patient's going to die anyway. And since the patient is in terrible pain, and whatever it is that I'm providing as the medical practitioner is sustaining the life of the patient, but we'll later talk about the quality of life. But the quality of life is just crap. There's a tremendous amount of pain, And granted, whatever you're giving me as a medical